Dr. Kelly J. Blodgett is redefining the modern dental experience. Over the past 20 years, he has created a practice recognized as an international hotspot for integrative biological dentistry and dental tourism. He attracts people who seek a holistic and biological approach to their oral health and whole body health. Through his weekly Toxic Tuesday and Wellness Wednesday social media posts, Dr. Blodgett shares truths not commonly discussed in traditional dental settings. His post series illustrates his patients' incredible journeys back to health, along with providing best practices for predictable oral and systemic health. My conversation with Dr. Blodgett was so lengthy and in-depth as we explore the role of oral health and toxic dental practices in the landscape of whole person health that this will be episode 1 of 2 episodes dedicated to understanding how holistic dentistry can be one of the best investments one can make in his or her health. Be sure to tune in for episode 2 of my discussion with Dr. Blodgett coming up here in a few episodes. But for now, let's enjoy episode 1 together. So welcome to the podcast, Dr. Blodgett.
Thank you. Glad to be here.
Yes. I'm so excited to have you on. So I will kind of just begin with sort of an introduction of how I found myself in the holistic wellness space. Specifically, dentistry was sort of my entry point into getting really heavy into the nitty gritty of how everything is connected. Yep. And the work of Dr. Weston A. Price was probably my first really big discovery and set of aha moments. And for anybody who's listening and is not familiar with Dr. Price's work or the Weston A. Price Foundation, he did a number of things both with nutrition and with dentistry, and then kind of linked those two together. But he had done some experiments with rabbits where he took the extracted root canal treated teeth out of people who had chronic illnesses, put them into rabbits, discovered that the rabbits would very quickly develop the same illnesses that the original human host had. And then as a control, he used healthy teeth that had been extracted for like orthodontic reasons and so forth, also put those into rabbits, and then discovered that the rabbit would just develop a fluid-filled cyst around that particular tooth, but didn't develop any illnesses. So he did a lot of really interesting work in that realm, but he also went on to study indigenous cultures and kind of analyzed what they were doing differently and noticed that the people in these cultures didn't have cavities. And so he did a lot of research in terms of nutrition, and I'm not sure he went into a lot of depth with jaw development. There are some other people who've done some research in that realm. But he really shed a lot of light over what we're doing wrong in the Western world that isn't in alignment with how our biology is supposed to actually operate. I personally had about a $15,000 dental revision. I've had 2 teeth extracted. One was a root canal treated teeth, or a tooth that when I was 10 years old, a girlfriend and I were playing catch with a rock at the bus stop. Anybody listening, don't play catch with rocks. It's a very, very bad idea. So I missed the catch and caught it with my mouth instead. So my number 24 tooth popped right out. And my family rushed me to the endodontist, of course, and I had a root canal. And it wasn't until many, many years later when I discovered, the work of Dr. Price, where I started to fit all these things together. But I will say very specifically, when I hit puberty, I definitely started having a lot of health issues that I wasn't able to shed light on until later in life, but definitely endocrine dysfunction, mental health issues, chronic fatigue, insomnia, so forth and so on. And the tooth thing, fits into a holistic perspective. I don't think it was just the tooth. But I will say with that $15,000 amount of dental work I've done in more recent years, the biggest radical shifts I had in my own health, at least in a short-term period of time, happened right after having, these two specific teeth removed. The second one was actually just one that had been dead in my mouth for many years, but we didn't know that until we kind of started doing some further testing. So let's maybe start there. And you can give us a little bit more information about your background. So I know that you have a psychology degree, correct?
Yeah, that's what I studied in college.
Okay. All right.
Mhm.
That's super fascinating. I had done a previous episode of this podcast with a gentleman by the name of Fraser Bailey, and he's the filmmaker who produced the movie Root Cause.
Yeah.
But what I thought was really interesting when I first discovered his work is that not only did he produce that film, but he also produced a film called Emotion 2.0, which was really about the mind-body connection. And I thought it was so interesting after I realized that he had both done, a film on the dangers of root canals and his own experience with that, as well as the emotional connection to holistic health. So if you can kind of tell us a little bit more about how you found yourself in the holistic dentistry space, and we'll kind of take it from there.
Yeah. Well, I have to go back almost 30 years,
Okay.
Part of my story is that, I was about to start my master's program in counseling. Both my wife and I had gotten into the same program, and we were excited to, be college graduates and heading on to the next educational phase of life. And, at the end of my senior year of college, I came to know Jesus Christ, and it just changed my life completely. And within about a month, I was feeling God calling me to become a dentist and reverse the negative stereotype of dentistry,
Okay.
which was, it was hard to understand at the time, but fast forward 30 years to where I am today. And it's like, I see, I understand now why I had to walk through 4 years of coming to appreciate how people think, how they talk, the words they choose, the mindset that they within the where pardon my I'm tripping on my words, the mindset within which they operate.
Mhm.
Um, it's like if we can't get beyond the point of resistance that many people have,
Mhm.
and for great reasons, frankly, with the dental experience, if we never make that human to human connection, then it's, in my opinion, it's kind of all for naught. Like there's negative emotion and thoughts wrapped up
Mhm.
in the care that people are receiving under the guise of what we call oral health.
Right.
But I'm a huge fan of uh, operating on a level where we're offering what patients want or what people want, and following their goals, as opposed to me telling them what they should do or what they need. So like even the words that I've trained my team to use, we take a black marker and cross out the words need and should in our practice, because we
Mhm.
want to make this about, is it consistent with your goals? um, and that's a very different mindset beyond what is traditionally referred to as holistic dentistry or biological dentistry. Those are more, I would argue, around the concepts of biologically compatible materials and, techniques. What I'm talking about is mindset first. The
Yeah.
other stuff is also important, but looking at human beings as someone with whom we are in partnership,
Uh-huh.
where I possess and my team possesses a certain set of skills, which, if they desire, we can help them, in whatever way they're hoping to. But I never tell somebody they need something. They don't need a crown. They don't need a root canal. They don't need their wisdom teeth out. Um, and that, that's a mindset I've had since I was in college, because that's why I believed that, the profession of psychology and counseling and thought processing and all that was so important in the first place. So it's really quite lovely to be able to tie that into
Right.
a dental uh, practice and
Yeah.
mission ultimately, hoping to pass this along to other professionals to see that if you start with human connection, the richness that flows from that is so incredible. My practice has developed into something I could have never dreamed. And it's really special to be able to see people heal, not just orally, but like as human beings,
Right.
to have emotional recovery through, for a lot of folks, recognizing challenges that they faced as young people, whether it was something like yours, where it's physical trauma,
Right.
whether it's, I mean, I heard a story just this week about with a new patient who was abused by her orthodontist, and it's, people experience some really rough stuff out there. So anyways, we want to create a space that is welcoming and loving and operating on a very high energetic level.
Yeah. Yeah. Maybe let's start talking with, a little bit of information about mercury amalgam fillings. And I actually have a quote on my website that's from Dr. Hal Huggins, and it's always resonated with me. It says something like, you can't towel off while you're standing in the shower.
Yeah.
So yeah, no, I love that.
Yeah, that's right.
Yep. So can you tell us a little bit about the history of mercury amalgams and
Sure.
why they're still being used, and why, maybe our listeners might want to consider having them properly removed and replaced?
Yeah, absolutely. Well, and so part of the history I find quite interesting is long before the American Dental Association existed, and this is going to pertain to the story in America.
Yeah.
There was the American College of Dental Surgeons, which was it's basically what the ADA is today. Well, back in the late 1700s, or I should say up until the early 1800s, there were really no effective ways to fill teeth. Imagine the technology of the day, right? No iPhones, no compressor systems for suction. I mean, it's very different technology. Well, the mercury filling was developed, which is 50% liquid mercury, 50% silver, copper, and tin. And when those things are mixed together, it creates this little putty that you push into a tooth. And, it certainly works for chewing, but it's toxic, obviously, right? So the leadership of the American College of Dental Surgeons was highly aware of the toxicity of mercury. This is 200 years ago, mind you. And they said, look, we get that it's functionally, it works, but biologically it's incompatible with human beings. If you're going to be a member of this organization, you won't use it. So, the dentists who decided, well, we're going to use it anyway, and we're going to start our own organization. That's the group that is now the American Dental Association, who till this day, if you go to their website, they finally, actually 2.5 years ago, right after COVID hit, they put out this quiet little press release that said, well, okay, while nobody was looking and focused on other things, of course, like, we do acknowledge that mercury is constantly given off from these things, but we think that it's safe, or studies show it's safe, unless you're a pregnant woman or a child of 6 or under, then it's not safe for you, but anybody else, we think it's safe. So, which is absolute craziness, right? If you think about the safety precautions we have to take, if a little compact fluorescent light bulb hits the floor and breaks open, and that little bit of mercury is exposed, which is still toxic, because there is no known safe level of mercury within the body. Yet the average filling, this is just to give the listeners a sense of like how toxic this stuff is, has about 1/2 gram, one filling. The average filling has approximately 1/2 gram of mercury, 500 milligrams, which is a ton of mercury. That's one filling. So you can imagine, I meet people every week who they might have 5 or 10 mercury fillings, and that's something that they're breathing in, because people do breathe through their mouths, especially after you imagine you have a hot cup of coffee or a warm piece of pizza, or, soup, and you're breathing through your mouth and you're just heating those things up. Anybody can go on Google and look up, what is it? The smoking tooth. There's
Okay.
a video. Maybe you can find the link to that. It's
Yeah.
amazing looking at, I don't know if it's a black light or what kind of lighted system they're using, where they actually heat up a mercury filling on an extracted tooth, and you can see the accelerated giving off of mercury vapor from this thing. It's just, it's shocking.
That's
Um,
wild.
so, thankfully, most dentists are moving away from it. The last that I saw, 50% of dentists in America still use it,
Wow.
which is shocking.
Right.
It's not only that, not only is the mercury toxic, which is horrible,
Hmm.
the what is required that we have to do to a tooth in order to get it to lock into it
Hmm.
is so traumatic to the structural integrity of the tooth. So think about it this way. As dentists, we were trained, I was in dental school in the mid 1990s. We were trained, you got to cut certain dovetailed shapes into teeth to lock. You're thinking of it like a piece of wood,
Hmm.
but it's a living body part. It's not a piece of wood.
Right.
So we destroy the structural integrity, put this filling in and pat them on the back and say, there you go. Once that happens, it's like clockwork. Somewhere within the next 10 to 30 years, the tooth either dies or it cracks, in such a way you can't restore it, or a lot of times it'll fracture and parts break off. And now you're crowning it,
Hmm.
or you're doing some sort of other restoration, and the physical abuse to the tooth continues. So, with today's technologies, lasers, air abrasion, uh, ozone, I mean, the techniques I've had in my practice for years allow a situation where frequently we do not even have to disrupt the structural integrity of the tooth. We can keep the anatomy intact and treat it biochemically and then seal things up. So we have the opportunities, again, with like lasers. Using
Hmm.
light to penetrate a tooth is like magic.
Wow.
It's a wonderful technique. We have multiple wavelengths of lasers in our practice, which allow us to think differently and more flexibly, which ultimately the idea is preserve natural anatomy and health.
Yeah. Yeah. That's great. So, with regards to mercury, and I don't think most people know, like mercury used to be used as a medication for a very long time.
Yeah,
And
yeah,
until they finally realized like maybe this is a bad idea.
yeah.
And I'm not going to go, too off the deep end in terms of, other controversial issues with heavy metals and medications that are or therapies that are still being used today. But the general consensus at this point, is most people do understand like putting mercury in your body is probably not a great idea, especially when we're telling, pregnant women not to eat tuna fish because there's too much mercury in the tuna, but you
Oh,
can keep it in your mouth
well,
forever.
think about that quandary, right?
Yeah.
So,
Yeah.
so when that mother, who understandably wants to kind of, make her body a temple once she finds out she's pregnant. I mean, the ideal thing would be, of course, before you're becoming pregnant,
Hmm.
you're working on removing these things, detoxifying your body so that your body is in a great state of health, so that when you start breastfeeding your child, your body's not offloading the
Exactly.
toxic burden you've been exposed to all these years. But, that's frequent. I mean, you can't imagine the number of DMs I get on Instagram every week about like, well, I'm 4 months pregnant, or I'm, nursing my 3-month-old, and I'm really concerned about X. And it's like, I totally appreciate that. I mean, I have 2 children of my own,
Right.
and it's like, oh man, the ship has sailed, right? Like, you removing those, it's still going to be a good idea, of course.
Right.
And there are ways to do it safely, even when you're pregnant, if it's appropriate. Um, but the thoughtful approach, of course, would be like, do that well ahead of time. Like if you're going to buy a house, you start planning and saving early. Well, if you're planning on having, starting a family, start building a stable health foundation long before you get pregnant, so that
Right.
you can produce the healthiest child possible.
Right. Exactly. So if somebody has come to the conclusion that, replacing their amalgams might be a good idea, I know there are protocols to do that safely versus just going to your, corner dentist and
Yeah.
not caring what kind of procedures they do. How what is there a standardized protocol for doing this, or how does that work?
Yeah, I mean, to an extent, right? So my belief system is I'm working with human beings who have autonomy and, somewhat like the protection to the nth degree, meaning that like they might want to wrap themselves in a Tyvek suit, which
Mm-hmm.
we have, and some don't. Some feel claustrophobic, and it's like, well, okay, so we're here to respect what you feel comfortable with, of course. Um, what's cool is, for decades, there have been dentists like myself who have thought critically about, well, okay, if I'm going to take this stuff out, we want to do so in the most protected way possible. So my point of sharing is that long before specific protocols through certain organizations came out 5 years ago,
Mm-hmm.
there were already dentists being conscientious about
Right.
this, right? But the two primary protocols currently, they're essentially identical. One is through the International Academy of Biological Dentistry and Medicine. It's called the Protect Protocol. And in that system, you're using all sorts of precautionary things. The International Academy of Oral Medicine and Toxicology, which is kind of a similar organization, slightly different stances on certain things, but generally about the same. Theirs is called the SMART protocol, stands for Safe Mercury Amalgam Removal Technique. Um, they're in essence, they are the same. You're using very specific protective gear, um, both for the patient and for the team. One of which is the most obvious is like this massive suctioning system. It's got a mouth on it about so big that we stick right by the patient's face.
Okay.
Um, when you walk in the room, it kind of stands out. It's this huge stack and it has a big nozzle. It looks to me like Snuffleupagus' nose for those of us who watch Sesame Street, you know,
Yeah.
and it's great. I mean, it's a wonderful thing to have in dentistry, period. We use it for every procedure because there aren't really many procedures in dentistry that don't generate aerosols, you know. So we've had those around since before the protocols existed because it was just a good idea to have them.
Yeah.
So every room, regardless of what we're taking out of the mouth or cleaning in the mouth, has those in there. So it's an awesome technique. Um, I talk about this with every patient for whom we remove mercury. Like, they're always excited, like, oh, I'm so glad that I'm not having any exposure relative to the fact that they're already exposed when they walked in the office. And they really appreciate that our team members also are having the minimum amount of exposure as well. Because,
Right.
we'll do thousands of removals per year.
Right.
So you can imagine, like, long before we had all these safety practices in offices, like dentistry is a chronically toxic exposure risk.
Right.
So yeah.
Right. Yeah. No, my mom used to tell this story about a family member of ours who went to a dentist, and the dentist ended up having, they found out later, Parkinson's disease.
Yeah.
And he must have been a little bit more shaky and took like a standard filling that this person was supposed to have, and it ended up turning into a root canal.
Oh
But
no.
I mean, there is, I think, I especially think of hairdressers and dentists when I think about, the occupational hazards of
Yeah.
the materials you're coming into contact with.
Oh yeah.
And in terms of mercury, when it's outside the body, it's clear and cut and dry that it's considered a hazardous material,
So
correct?
dumb.
Yeah.
It's so dumb. Not only that, but like when we're taking out a filling, let's say it's a bigger filling. One
Yeah.
of the tactics that I'll use is to do what they call chunking. So you kind of cut around it and then remove the bulk of it, so you're not turning it into, like, pulverizing it, basically.
Yeah.
That has to go into a specific container for toxic waste.
Mm-hmm.
How insane is that?
Mm-hmm.
And by the way, we have like a $10,000 suction system, connected to our suction lines, that is a mercury separation system, because it's, again, it's toxic when it comes to you in the box.
Okay.
It's toxic when it's shaken up and it's before it's in the tooth, and somehow miraculously, you put it in the tooth and, oh, it's safe now, which is
Right.
it's absolute insanity.
Right.
It's interesting because we have socialized human beings to believe that because the ADA,
Hmm.
the group on high says, well, there's not enough scientific evidence. I mean, how about common sense?
Right.
Common sense. We wouldn't let our children play with this, right? I mean, we would imagine what you do to protect your child from this stuff. And yet we plug it into teeth and, wonder why chronic mental illness is on decline or increasing rather. It's like, think about all the toxic exposures we have. And dentistry is, frankly, it's one of the worst offenders historically.
Hmm.
I know we'll probably talk about energetic disruption later, but
Yeah.
think about that. You're putting a metal alloy in an electrolyte bath, your
Hmm.
saliva.
Right.
It's going to have an energetic impact, period.
Right,
So,
right,
yeah.
right. And on that note, I read too before where anytime I'm kind of digging back into chemistry class in my head here, anytime you have two different metals in your
Yep.
mouth, there's a
Yep.
difference in charge,
Yes.
and that can be disrupting of your energy in your body as well.
Yep. It creates, it's a galvanic response. I mean,
Galvan, yeah.
I was actually having an interesting conversation with a patient yesterday. We had placed a ceramic implant for her and, things have healed up and whatever. And she was coming back for something else. And I noticed she had a metal like ring in her lower jaw. And I'm like, oh, like what'd you have done there? And she's like, well, I was missing this tooth and this other dentist closer to my house does implants for cheaper. And so I went, I decided I would have him do the titanium implant on the lower. And believe it or not, I mean, this is her thinking, and I make no judgment about it, but she's like, I figured I'd do ceramic on the upper jaw because it's closer to my brain and metal on the lower. And I'm like, okay, well, that's your call. Again,
Right.
no judgment, but here's what she shared. She said after they put the implant in, things felt fine because it's the only metal in her mouth, mind you,
Hmm.
which is kind of interesting. When they went back to screw on what's called a healing abutment, it trains your gums to, look as though a tooth is coming out of it. It's a dissimilar metal.
Hmm.
And she said, as soon as they connected it, she had the worst pain in her jaw she'd ever experienced in her life. And it took about 3 hours to go away.
Oh,
And
wow.
she was going to go back the next day, but then it went away. And so I explained to her, like, like when you go to a rock concert or you hear a loud noise or something, and like it's so loud at first, and then you habituate to it.
Hmm.
Your nerve, or like a hot tub. Oh my gosh, it's so hot. But
Right.
then after a few minutes, like you
You
adjust to
kind of
that. So
acclimate to it.
the fact is, the energetic charge didn't dissipate. It's still present and it's going to alter everything on that meridian,
Hmm.
unfortunately. Yet her body has habituated itself to the energetic flow, which is what we
Right.
do. And for people who continue to have more and more metals, there will be a point in time where the last metal will get added. Maybe that's the third metal, maybe that's the 10th metal, and your health will go into crisis mode. I mean,
Hmm.
I've seen this so many times, like people become non-functional.
Hmm.
And then as you remove them one at a time, literally, I've watched people in my chair have complete health metamorphoses as we're sitting there removing. It's fascinating.
Hmm.
Uh, it's almost hard to believe, frankly, except that I'm sitting there and watching their life experience.
Right.
So it's amazing, and it's really, people don't think about how many metals they might have in their mouth when they've had, crowns with metal bases. They might have orthodontic retainers. They might have titanium implants, abutment screws. There's just so many metals you can have in you might have plates from traumatic surgeries, or like, even oral surgery that's done to correct jaw malformations. Like all these things add up.
I've heard wild stories of people with different metals in their mouths, like tuning in radio signals. Is that really true? Can that
I,
happen?
I would absolutely believe it. I mean, think about it. You're a walking, talking
Antenna.
system of energetic charge. Now, we're pretty well insulated from that sort of, generally speaking, right? Like
Right.
AM and FM radio signals. I mean, for years, that was like, less of a significant issue. The electromagnetic noise within our environment has gotten so much greater.
Mm-hmm.
So, it is what it is. We're never going to escape this, right? I mean,
Yeah.
because we're surrounded with the modern world with which we're surrounded. But what we can do is, of course, decrease risk within our body and
Right.
understand that when we expose ourselves to metals, not only are they here right next
Mm.
to our brain,
Right.
but as they ionize, they give off charged particles. Your body's going to absorb that and put them wherever it deems fit, whether it's your brain, your kidneys, your liver, pancreas, it's your thyroid. I
Yeah.
mean, it's risky stuff. So again, like we've all had exposure. I had a mercury filling as a kid, um, and then when I understood more, it's like, okay, well, cool. Let's take it out safely. Let's live, live a lifestyle that's reasonably clean. I mean,
Mm-hmm.
there's no perfection, right? So you might
Right.
as well give
Right.
up on that, enjoy life a bit, but make some good plans. I had somebody ping me today, like, how do I prepare myself for detox for when I'm having my mercury fillings removed? And I said, if you're moving your body,
Yeah.
drinking clean water, so that you can pee frequently
Mm-hmm.
and pooping regularly, like the
Yep.
the simple things your body was designed to do to detox, then you're going to probably do pretty well. Of course, there's some other things you can add to that, but
Mm-hmm.
that's probably 90+% of it, just
Right.
simple, basic, physiologic detox,
Right, right. And there's probably something to be said about lymphatic flow too. I got up this morning and did
Yep.
some rebounding outside, which is a great way to get your lymphatic fluid moving. But the proximity to your mouth and I've are you familiar with the book The Toxic Tooth?
Oh yeah, absolutely.
Yeah, so I've had some conversations with Dr. Thomas Levy, who's the co-author of that book. But
Yep.
he's always talked a lot about particularly for cardiac and breast health,
Oh yeah.
the just how that drains into the same system as the breasts.
Yep.
So if you've got a lot of infectious stuff going on in your mouth, it's not going to stay isolated there. Right.
No, he was one of my instructors in my integrative medical dental college,
Oh,
and
I love him.
just what a great
Amazing
guy.
man.
And yeah, I love what I love, and I share this in every talk I give. Like the books that I have read over the past decade, the majority of them are written by physicians
Mm-hmm.
who are seeing, oh my goodness, after 30 years of practice, as you have enough experience, you start to see the patterns, like, huh, all these root canal teeth, cavitation areas and jawbone, mercury, like they have a massive impact, and we're by and large, we're just ignoring it. And of course, let's just manage your symptoms with pills. And it's a crazy system. Makes no
Mm-hmm.
sense at all.
Yeah.
But, that's why we're
Yeah.
talking about this and hopefully creating awareness.
Exactly. Exactly. And I know his kind of first foray into that arena. He's a cardiologist. But he ended up with Hal Huggins as his mentor and ended up going into his practice and seeing that, in conjunction with doing these extractions of root canal treated teeth and other infections and cavitations and so forth, that he was treating his patients with IV vitamin C. And he really got off into putting a lot of research behind that information. And I know we're going to probably talk about ozone too here in a little while, so we can kind of pull that in. But so kind of moving on from the amalgams, if people have decided that they want to have those removed from their mouth, what is the alternative?
Oh, in terms of what you're going to place in the tooth?
Yeah.
Yeah, sure. It depends on the size of the restoration that's there to begin with.
Okay.
I would say the general materials out there are dental composites.
Okay.
Understanding that it's great because you can bond it to a tooth. It looks like a tooth. The primary downside to that material is it shrinks.
Okay.
So imagine when you put it in the tooth, if you do not use very thoughtful technique, imagine you stick the whole thing in at once,
Mm-hmm.
and then you cure it, it's going to debond off of one of the walls, or it's going to squeeze the tooth, which I have seen many times, and it'll put it into a constant state of pain. So there are techniques, very simple techniques by which you can minimize that shrinkage stress, but just
Okay.
know that that is a risk. So the way that you can avoid that risk, of course, is to use ceramic restorations, where in my practice, we do that using a CAD/CAM system called CEREC. It
Okay.
allows me to, take out the mercury filling, recreate the shape so that I can, drop in an inlay, like a restoration that's a puzzle piece that fits
Hmm.
perfectly. And then we use just a little bit of composite cement to glue it onto the tooth. The beauty is, both aesthetically and functionally, the dynamics of the ceramic are exactly like enamel,
Hmm.
and there's no shrinkage stress. So it's like, why not? Now the reasons that I wouldn't use a ceramic is if it's so tiny, I literally can't hold onto it with my fingers.
Right.
Well, then use composite. So there's a mixture, and then there's some other outlier materials that we might use, but those are the two primary materials. There's very safe. Make sure that your dentist polishes your composites before they remove the rubber dam. It's that top layer that's the oxygen inhibited layer, that's the toxic layer. As long as
Hmm.
they polish that off, the rest of it will remain, fully polymerized and present the least amount of health risk. Understanding there is no dental material as good as your original tooth structure. So, if if you can choose a nutritional path and lifestyle that honors your general physiology and biology, that'd be awesome. So the best dentistry is no dentistry at all. So
Right.
if we can avoid that, that'd be the best way to go.
Right. Right. Um, and is there, in terms of cavities, is doing a filling always the answer, or is there a way to actually reverse cavities or remineralize the teeth?
Yeah, that's a great question. Generally speaking, so you got two layers to the tooth primarily. The enamel, which is like crazy hard and acid resistant. It's the protective layer, right? Like
Hmm.
when we're smiling at each other, we see like that's the enamel we're looking at. The second layer, the dentin, is mostly collagen. So as let's say somebody's been sipping on kombucha, we're just going to pick on kombucha, right?
Okay.
Or maybe they've developed this habit of like, oh, I heard it was really good to drink apple cider vinegar and lemon water in the morning, and so they start sipping on this stuff for 4 hours.
Yeah, I'm
Well,
guilty of
suddenly,
that.
oh yeah,
Yeah.
it's not. It's common. It's common.
Yeah.
So uh, all of a sudden, you start seeing the enamel breaking down. Like when we're taking these bite wing X-rays, we'll see
Mhm.
like, huh, that's interesting. It's becoming darker. We're actually, and what that is telling us, it's losing mineral. And your saliva is designed to help you remineralize teeth. But
Mhm.
if we're constantly dipping into the acidic bath of whatever it is we're drinking, that's going to create on the health balance, the remineralizing phase is going to lose out. So it is absolutely possible to remineralize your teeth. That's what your saliva is designed to do. But in today's world where people are constantly snacking, it's like
Mhm.
everything's in a squeezy tube or a twist top bottle. Um, like if you're drinking water all day, fair enough. Like you should be fine. You add lemon into that water and sip on it for 8 hours, your teeth will break down. So it's possible to remineralize. However, if it gets into that second layer of the tooth, usually, into
Mhm.
that dentinal layer, typically at that point, because the dentin is porous like a sponge,
Right.
well, stuff starts to spread out, and usually that's going to require some sort of restorative method. Um,
Okay.
I work with people frequently because they're like, well, can we try remineralizing? As long as they're open to like monitoring, just like somebody who might want to take a less invasive approach for their cardiac health. Let's say like, sure, let's try this. Let's try diet and lifestyle or diabetes. Let's
Mhm.
try diet and lifestyle and let's see, but we're going to have to monitor it. So it's different than like, oh, I see a little dark thing, time to drill and fill, right? I mean,
Right.
that's sadly there are practitioners who think that way, and it's a monkey see monkey do approach. It's not healthcare,
Mhm.
and unfortunately, there's a lot of people who suffer from that. So I would encourage the listeners, whenever your spidey sense starts to tingle, like that seems weird. or
Hmm.
I don't get this. Do not consent to care. You can always come back another day, make sure you fully understand what you're consenting to and the risks.
Yeah.
I don't
Yeah.
know. I mean, I did my Toxic Tuesday post this week lit up a massive bunch of comments. It's about a woman who had her teeth all ground down for crowns, not understanding that the greatest risk of doing that was that her nerves and her teeth could die, which they have. And
Right.
now at the age of 30, she's losing teeth. And it's just, it struck a chord with hundreds of people who have experienced the same thing. So always ask questions. A good provider will welcome those.
Yeah. Is there a risk with veneers? I mean, do you have to grind down part of the teeth in order to attach those? Does that,
It's a great question.
yeah.
A great question. So 20 years ago, and I was a newbie dentist, and the idea, this is just because of where I come from and my own personal comfort level. I was like, there's no way in hell I'm going to grind down somebody's tooth just to make it look sexier. Like that's not, I,
Right.
I understand that there are dentists that will do that. I'm not wanting to take the risk on of the fact that the tooth might die. Now, what's cool is that going back way more than 20 years ago, a guy named Bob Ibsen was probably the first dentist to develop a ceramic material that would have as much strength as a traditional ceramic material, but it would only be about a third of the thickness. And he developed this whole thing called lumineers. And it was, they used to do a lot of marketing and stuff. When I saw that and I realized like, oh, so you could literally imagine this, a veneer that is 1/3 of a millimeter thick, like a contact lens,
Oh,
that
wow.
you could lay over people's teeth. You can control the opacity of it and the shade of it. You can control the color of the bonding cement underneath it. So, I mean, that I would say probably 15 years ago was something I did a lot of, which was non-invasive smile makeovers.
Okay.
I would take away 0-2 structure and could like transform smiles. And one of the coolest things was if, let's say something chipped, because it happens from time to time.
Right.
I developed a technique using pulsed laser energy where you can pop the veneer off and not affect the underlying tooth structure at all and just
Hmm.
polish off the cement. You go right back to where you started. No affecting the substructural tooth at all.
Hmm.
So again, the fusion of what we have available technologically today,
Hmm.
when we think about the psychology of the patient and respecting the biology of that patient, that fusion of thinking is creating experiences unlike anything before in the history of oral health.
Hmm.
The problem is most dentists haven't taken the time to, pursue the understanding of all three of those things, the technology, the biology, and the psychology.
Hmm.
So it's possible to absolutely have 100% positive dental experiences, even if you want a smile makeover,
Right.
right? You're like, I want a wider smile. I want it permanently wider, so I don't have to be using, trays. Like, absolutely, that's possible for most people. And there's a way to do it where we don't abuse teeth.
Right. Right. That's great. That's great information. Let's maybe move on to root canals. We could probably be here for hours on this one. So like I mentioned, I had a root canal treated tooth electively removed, and I think there were a lot of people in my life at that time who thought I was completely nuts
Yeah.
for doing so. Like, why would you take what seems to be a perfectly good tooth? And in my case, it wasn't just the root canal treated tooth. I had a metal post sticking down the middle of it to attach the crown on top of it. And I remember the holistically minded dentist I kind of started out with on that journey kind of looked up what materials might be in that post
Yeah.
based on the year that I got it. And that alone was kind of appalling. But so what are the general potential health consequences of having a root canal and leaving it in your mouth for years?
Well, oh my gosh, you're right.
Yeah.
We might need to talk 2.0 on this. So one of the things I think that we could do here is kind of go back to that awesome story that you shared of your own life and how you noticed when you hit puberty, some
Hmm.
significant changes
Yep.
go on because that tooth number 24, is on the energy meridian of your ovaries and
Yep.
reproductive system. It's like,
Yep.
hmm,
Mm-hmm.
probably no connection at all, right? I mean, of course, that's silly.
Mm-hmm.
As you were talking to, thank you for sharing how there, in essence, was some judgment placed upon you by people in your life
Yep.
about the idea, get this, of removing a chronically infected organ.
Mm-hmm.
Now, if you had the slightest inflammation of your appendix, God forbid, right? You'd be rushed to the hospital and, oh, we got to take that out immediately. Why? Well, because we can't have infection in the body. Well, wait a minute. We can't have infection in the body, but we can leave an infected tooth in indefinitely. And worse yet, we will tell you as professionals that you're crazy for thinking that.
Right.
That it's having any impact on your health. It is the stupidest thing ever. Now, I'm not saying like nobody should have a root canal. There are certainly situations where it's the best of a bunch of crappy options.
Right.
But by the time, I mean, honestly, who wants to get hit in the mouth by a rock, right?
Right.
I mean, that was not an intentional decision, and you made the best choice that you could at the time.
Right.
So, but your body was telling you along the way, I understand this. You had this done. The upside is you kept the tooth. It's functional, but the body is going to have some impact. So, and that's to get to you back to your question. Sorry for that circuitous way of getting back to
That's
this,
okay.
but when you ask about how it impacts the body,
Mm-hmm.
it affects, or it has the potential to affect every part of your human experience, depending on the area that has been treated.
Right.
So I've shared a story. If you don't mind, I'll share it now
Yeah.
because I find it so fascinating. Of a gentleman I had seen probably 4 years ago as a new patient. All three of his sisters, interestingly, were patients, and they all kind of follow a holistic lifestyle. And they had suggested he come see me because he had about, I don't know, 8 mercury fillings, right? And it was all his molars, which is very common for people, which, by the way, happened to be connected to the large intestine.
Mm-hmm.
Just interesting note. So along with other parts of the body. So he comes in, we make the suggestion about, well, okay, here's how I would imagine, helping you, taking the mercury out safely, using the least invasive ceramic inlay or onlay, bonding it onto your tooth. It should have little to no impact to your health. There we go. And it, gave him his estimate. Well, understandably, he chose to get a second opinion to the dentist down the street from his work, who's on his health insurance or his dental insurance plan.
Mm-hmm.
The guy says, oh, well, you know what? Yeah, I think they need some work. We can crown them all. Right.
Right.
So, and mind you, these teeth had not the largest mercury fillings in the world. I mean, it would not have been a very invasive process to remove it and replace it conservatively. But instead, he had the teeth spun down for crowns, which is an incredible amount of friction. Think about that. The burr is spinning at 200,000 RPMs. Right? That's a lot of heat.
Mm-hmm.
So, of course, we're trying to dissipate it with water spray and all that. He has these crowns done. Within a year, 1 year, 3 of those 4 teeth had died and he had root canals. And I remember receiving an email or call from him maybe a year and a half, 2 years after I had first seen him. It was
Mm-hmm.
right after COVID hit. So, it was this weird time where it's like, we're at the office to treat emergencies and whatever. And his emergency was he could not have a normal poop to save his life.
Uh-huh.
Now, again, think about those dead teeth now on the large intestine meridian. And he looked massively bloated. He wasn't detoxing. It was the weirdest thing. He looked like a different human being. So he came in, he decided we took out those 3 teeth. They'd only been dead for not even a year. 2 weeks later, when he came in to get his stitches out, in those healing sites, he had lost 20 plus pounds of water weight just from his detox systems getting back online. And since the time the teeth came out, his poops had normalized.
Wow.
And he was like, I can't believe the difference. And that is the difference, right? Of thoughtful, intentional, biologically respectful care
Mm-hmm.
versus just, what the hell, it's a tooth, spin it down. Like literally again, we're taught to think of it like wood or plastic might be a better way of thinking about it. Because how did we get trained in dental school? We used ivorine teeth that are literally plastic teeth. And, your model doesn't complain when burn it up. It's like, that's crazy. So
Yeah.
the point being, you know, respect the health of the tooth and things will likely go very well at whatever point of health the tooth is.
Mm-hmm.
Now, once it's dead, there's no more health to that. It's just a functional, it'd be like, well, my foot went gangrenous. I mean, this happens, by the way. Of course, people who have diabetes, let's say, a toe or part of, a large part of the foot goes gangrenous. I understand it's totally disgusting and black, but I mean, it's part of my foot and I'm just going to keep it there because it gives me something to kind of balance on. I know I don't feel it, but no, I mean, the physician would tell you, that's a gangrenous body part. We need to remove it in order to preserve the health of the rest of your body.
Mm-hmm.
That's what a dead tooth is. It's gangrenous. I just took one out yesterday. I'm going to put it on Toxic Tuesday soon. The whole thing was literally black, and the size of the abscess I pulled out of this poor guy's jaw, it was the body, it was trying to confine it all. And, he's suffering. His health is suffering because of this gangrenous tooth that's still attached to living jawbone. And we call it normal and tell you you're crazy if you think it feels weird. It makes no sense.
Are there situations where like a tooth dies, but like calcifies?
Well, sure. I mean, there's all sorts of iterations of teeth becoming. Now, it depends on what you mean by dies, right? Like
Yeah.
a tooth can experience trauma,
Uh-huh.
such that, and teeth are weird, the cells inside, we have these cells whose job is to build additional dentin. So let's imagine you had a cavity. The tissues inside and the nerve and all that know what happened. It's part of your living organism. These cells will add, it's kind of like putting up new spackle inside your tooth to protect the nerve from that biochemical activity. Sometimes due to trauma, they'll just go crazy and they'll add so much dentin that it just closes off its own, vital nerve and blood supply.
Okay.
Now, if in those situations, let's say the dentist will often, use like a cold to test the tooth. And like, oh, well, the tooth doesn't feel cold. Well, yeah, because it kind of strangled itself. You'd have to consider for that person, like, is it appropriate to remove the tooth because it doesn't respond to cold? How are the tissues around it doing? This would be a great situation, in my opinion, for either some type of energetic testing, like muscle testing, acupuncture meridian assessment. Some people will test the quantum energy, like doing pendulum stuff. I mean, I've worked with all sorts of different energy testers and healers,
Yeah.
and it's awesome because I can't tell somebody if I'm using an electrical test and a cold test if the tooth says I'm dead from a neurological standpoint, but energetically it tests balanced. I would leave that tooth.
Mm-hmm.
Whether that's muscle testing or acupuncture meridian assessment.
Okay.
Both of those are really cool. I don't do them.
They are.
Yeah.
I actually ended up going up to Wisconsin when I was going through my own dental journey to visit this very holistically minded retired dentist at the point. And he did, I don't know what it's called exactly, but with the metal lead in your hand where you touch your tooth and then it registers how vital the energetic flow is. It's almost like a jumper cable kind of assessment.
That's was that Dr. Cook?
Yes.
Yeah.
Lovely gentleman. Yes.
Yeah. He wrote a book called Saved by My
Saved
Dentist.
by My Dentist.
Great book. Yeah. So he trained Dr. Simon Yu in St. Louis, Missouri, and I've done a lot of work with Dr. Simon Yu. I actually read his two books, Accidental Cure and Accidental Blow Up in Medicine, which that was about 4 years ago, I guess, when I read those. And I'd already done some work with Dietrich Klinghardt up in Seattle, looking at his version of muscle testing, which is awesome, but it wasn't really my language,
Mm-hmm.
which I really like what Dr. Yu calls acupuncture meridian assessment. The original term was electroacupuncture according to Vol, or EAV work.
Okay.
Um, I love it. We have one of my team members currently who's in the training process so that we can have that as a part of our assessment protocols, particularly when imagine we're taking out a dead tooth, right?
Mm-hmm.
And we know that if there's a dead tooth in the jawbone, the bone peripheral to it isn't stupid. It's highly aware that, and depending on its age and the person's state of health, it might be hyperinflammatory, it might be necrotic and dead.
Mm-hmm.
You can actually measure that energetically. So what a great tool to include, not only pre-surgically, but during surgery, when you're removing the peripheral bone to that tooth, how much is appropriate to remove for any given person? Well, there's
Yeah.
nothing set in stone, right?
Right.
So we're looking to integrate that hopefully within the next 6 months.
Yeah. Yeah.
But it
Interesting.
is awesome. That's so awesome. You saw Dr. Cook. Well, that's amazing.
Yeah, yeah, amazing guy. And I don't want to go too much off into a tangent on like medical politics, but he actually had to remove that device from his dental practice because the state dental board came in and said you can't use this.
Oh,
And similarly, that I can't remember his name, but the gentleman who co-wrote The Toxic Tooth with Thomas Levy, his career was over after he wrote that book. He had so many complaints. I think it was the New York State Dental Board.
sure.
He ended up having to stop practicing, I believe, not necessarily because his license got taken away, but because of whatever dynamics were there. His malpractice insurance was going to be too expensive to even continue
Yeah,
practicing.
that's right.
And sadly, I think we're seeing so many situations, both in dentistry and medicine right now, where the doctor's ability to practice medicine as they see fit is being replaced by this box store model of medicine, where unfortunately, doctors are almost being forced into being, like these box store employees rather than what they signed up to
Yeah.
be, and have lost the curiosity to be able to go into, it is the practice of medicine. It's not, an exact science. And unfortunately, I think, the term evidence-based, not that it doesn't have any validity, but has replaced the idea of experience-based. And that's kind of, where I see, especially doctors like yourself, you have so much field experience and seeing what actually does work and doesn't work on a bio-individual basis,
Yep.
that we're replacing that with epidemiological models that just don't serve individuals.
Right.
So,
Absolutely. Well, it's interesting. One of the things that I'm very intentional with how I use words.
mhm,
So when I write, which I started almost 4 years ago, writing my Toxic Tuesday and
yeah,
Wellness Wednesday post series, I don't make any claims that because health is not black and white. It's not like, well, you do this, this happens. It's not that way for anybody. What is true is that a human being's experience is valid for themselves. So as
right,
we share an individual's journey and their story and their own experience of moving back into health, due primarily to the resolution of health or oral health issues, who can claim that that's not true for them?
right,
I mean, granted, I've had many an angry response that are like, you can't say this. And I'm like, well, it's their experience. Like, who are you or I to say that that's not their life experience? And I do, whenever possible, uh, offer a scientific backup, so to speak. But of course, science is subjective. It's not objective.
right,
Because how do we know this? Because the things we understand today are vastly different from what we understood 10 years ago, 100 years ago, 500 years ago. Science is a
exactly.
constantly evolving concept. I was speaking to a group of dental hygiene students a few months ago, and I was sharing the concepts of understanding various energetic levels. Like when we're using words like need and should, we're functioning at a very low level where the emotions tied to need and should are things like guilt and fear. So if you want to have a very low energy state in your practice of oral hygiene, then go ahead and use the words need and should. You're going to have patients that hate going, and it's a bad
Right.
experience.
Right.
Versus thinking about honoring autonomy and operating in a state of without judgment, and where love is, that's what we're embodying for other people. People are going to tell you things like, I can't believe I'm saying this, but I'm excited to remove my root canal. And it's like, well, why is that? It's because there's trust and respect. And,
Yes.
it's such a different level of functioning. And anyways, her comment to me was, where's the science behind this? And I asked her, I said, well, how do you define science? Which pretty much just angered her, and she literally stormed out of the room. But, it's like, it is a problem in healthcare that when we challenge the dogma that we've been trained to think with, that's a huge problem. Because I got to say, the greatest gift I receive every day are the challenging questions that I'm posed with by the patients whom I'm there to serve.
Right.
They ask me things like, as a matter of fact, you mentioned Dr. Levy's book about vitamin C, Curing the Incurable.
Yep.
About 5 or 6 years ago, a patient came in and she was holding that book in her hand. She asked me, she said, hey, have you ever read this book? And I said, no. And she said, well, then this copy is for you. I'm like, oh my gosh, thank you so much. And
She sounds like me.
yeah, I was like, this is such a gift. And later that week, I was flying to a dental course and I read it on the plane. And, that was my first introduction, to Dr. Levy's understanding of vitamin C. And, now he's a colleague. It's like crazy. But
Yeah.
the patients they just have the best perspectives. And unfortunately, we as professionals have been trained not to listen, to push this concept that we're the expert and their job is to do what we tell them, which is crazy. There's no growth in that.
Yeah.
It's a
Yeah.
low energetic state way of operating.
Yeah.
In my opinion, generally speaking, not all the time, of course. Sometimes the things that we have to share are really valuable, but not at the cost of a person's autonomy.
Yes. And I feel like there's been this cultural shift, unfortunately, where most people aren't taking ownership of their own agency, and have kind of outsourced their decision making to quote unquote authority figures.
Oh,
And
no.
some of those authority figures have earned, the right to maybe, possess that level of influence, but the majority I don't think have. And I think there's so much to be said for doing your own due diligence and listening to your inner voice,
Oh, yeah.
that so many people have just at this point been culturally conditioned to be dismissive of that, intuition or inner voice that they have of something just not feeling quite right,
Yep.
and not following where their heart really truly seems to be leading them. And I'll say I'm kind of jumping ahead to maybe a topic we're going to talk about a little bit later, but I think our notion of the role of the autonomic nervous system in its impact on overall health is going to radically transform medicine as we know it. And, just kind of what you were talking about, that whole perspective of fear earlier. And this was my difference between the first tooth extraction I had and the second one. The first one, I was terribly nervous, didn't know what to expect. It took much longer to heal. It was more painful. I took more pain medication after it. But there were a couple of years between those two experiences, and number 13 was the second one I had extracted. I had done so much personal work in the realm of learning how to have agency over my autonomic nervous system that I went in, meditated for a few minutes before the biological dentist I was working with got started, and just really paid a lot of attention to my breath while we were working. required almost no anesthetic. And I think I took one homeopathic painkiller after the procedure. They
Yeah.
wanted to renumb me in the middle, and I was like, no, I'm fine. There was such a difference in my nervous system of possessing that fear that translated into pain that I didn't even require most of what they would normally do. So
absolutely. Well,
yeah.
that's, you bring up a really good point. One of the things I have observed over the, few decades of doing this is the patient, this is like earlier on in my practice when I first was working with anesthesiologists.
Mm-hmm.
The situations where we would do significant surgeries, like removing parts of bone and teeth and what have you, those people's healing was just remarkable. Like it dawned on me, well, they're not releasing any stress hormones, because they're literally asleep through the whole process. So we still work with people using anesthesiologists because of the length and, breadth of things that I do for folks a lot of times. But for a lot of I'd say the vast majority of our patients, in order to elevate the parasympathetic nature of an experience in our chairs, we use a system called Alpha Stim that we connect to the earlobes, no drugs whatsoever. And this Alpha Stim device puts your brain into an alpha wave phase, which is that pre-sleep, like I'm kind of dozing.
Mm-hmm.
People generally describe it like, it feels like I had a glass or two of wine.
Oh, yeah.
And so they're just sitting there, and it's like, not for everybody, but for most people who use it, it's like a total game changer. And then we have them go utilize our Novathor bed, which is a full body, looks like a tanning bed shape, full body red and infrared light therapy bed for 12 minutes.
Yep.
And they're so zoned out and peaceful, by the time they're completed. And of course, we send them home with a red light therapy unit, homeopathics, and a lymphatic drainage remedy. The vast majority of our patients never take a pain pill, not even an Advil. Now, some do, and that's no judgment, whatever works for you. But most do not. And it's just so cool, at this point in my career, to be offering way more health, than ever before. It's such a gift for the patient,
Right.
I hope you enjoyed this episode of the Body Literacy Podcast with Dr. Kelly Blodgett. Dr. Blodgett was so generous with his time that we opted to carry over into a second episode. So be sure to subscribe to the Body Literacy Podcast as we will continue the conversation with even more insights about holistic dentistry and how the health of your mouth greatly impacts the overall health of your body and mind in an upcoming Part 2 episode.
This podcast is for informational and entertainment purposes only. Any statements and views expressed by myself or my guests are not medical advice. The opinions of guests are their own, and the Body Literacy Podcast does not endorse or accept responsibility for statements made by guests. If you have a medical problem, please consult a qualified and competent medical professional. As always, I hope you enjoyed this episode of the Body Literacy Podcast. Be sure to subscribe and sign up for updates over at jenmayo.com.